The video will cover the complex condition of end-stage heart failure, including its pathogenesis, symptoms, complications, and treatment options. It will also explore advanced therapies, heart transplantation, palliative care, and ethical considerations. Medical students will gain a deep understanding of this topic. End-stage heart failure is when the heart's pumping ability is severely compromised. It is caused by factors like coronary artery disease, hypertension, and previous heart attacks. We will explore the cellular changes and the role of inflammation and oxidative stress in its development. In end-stage heart failure, there are significant hemodynamic changes. Cardiac output is reduced, ejection fraction is decreased, preload and afterload are altered, and contractility is impaired. Understanding these alterations is crucial for diagnosing and managing advanced heart failure. Neurohormonal activation, specifically the renin-angiotensin-aldosterone system and sympathetic nervous system, worsens heart failure. It causes vasoconstriction, water retention, and heart remodeling. Targeting these pathways can improve patient outcomes. In this section, we will explore prognostic indicators and risk stratification in end-stage heart failure. We will discuss factors such as NYHA functional class, ULF, BNP levels, exercise capacity, and comorbidities, as well as risk stratification models like the Seattle Heart Failure Model and the Heart Failure Survival Score. These tools help guide treatment decisions and provide accurate prognosis for patients and their families. In the video's fifth section, we'll cover advanced heart failure therapies like LVADs and ECMO. We'll explain these treatments, when they're used, who can benefit, and potential complications. These therapies offer hope for end-stage heart failure patients who can't have heart transplants. Heart transplantation remains the gold standard treatment for selected patients with end-stage heart failure. However, not all patients are suitable candidates for this complex and resource-intensive procedure. We will discuss the criteria used to evaluate a patient's candidacy for heart transplantation, including the severity of heart failure, coexisting medical conditions, psychosocial factors, and assessment of overall frailty. The evaluation process involves an interdisciplinary team of healthcare professionals, including cardiologists, transplant surgeons, psychologists, and social workers. Understanding the process of evaluating candidacy for heart transplantation is vital for medical students to provide comprehensive care to patients with end-stage heart failure. Mechanical circulatory support devices serve as a bridge to transplantation or as destination therapy for patients with end-stage heart failure who are not eligible for heart transplantation. We will explore the different types of mechanical circulatory support devices, including intra-aortic balloon pumps, IABs, ventricular assist devices, VADs, and total artificial hearts, TAs. Each device has unique mechanisms of action and indications. We will discuss the benefits and limitations of these devices and the considerations in selecting the appropriate device for individual patients. Additionally, we will explore the management strategies and potential complications associated with these mechanical circulatory support devices. In this video, we will discuss the role of palliative care in managing symptoms, providing psychosocial support, and improving quality of life for patients with advanced heart failure. Refractory heart failure symptoms pose a significant challenge in the management of patients with end-stage heart failure. Despite optimal medical therapy and advanced interventions, some patients continue to experience debilitating symptoms, including dyspnea, shortness of breath, edema, fluid retention, and fatigue. We will explore various pharmacological and non-pharmacological strategies for managing these refractory symptoms. This may encompass the use of diuretics, inotropes, vasodilators, and interventions such as ultrafiltration and thoracentesis. Furthermore, we will discuss the potential benefits of exercise training and cardiac rehabilitation programs in improving exercise capacity and reducing symptoms in patients with end-stage heart failure. End-stage heart failure often coexists with various comorbid conditions, which can significantly impact patient outcomes. We will explore the influence of comorbidities such as diabetes, renal dysfunction, pulmonary disease, and anemia on the prognosis and management of patients with advanced heart failure. Understanding the interactions between these comorbidities and heart failure is essential for tailoring treatment strategies and optimizing patient care. We will discuss the unique challenges associated with managing patients with multiple comorbidities, including potential drug interactions, conflicting treatment goals, and the need for a multidisciplinary approach to care. The care of patients with end-stage heart failure often presents complex ethical considerations. These include difficult decision-making scenarios, treatment futility, withdrawal of life-sustaining interventions, and end-of-life care. We will explore various ethical frameworks, such as autonomy, beneficence, non-maleficence, and justice, that guide clinical and ethical decision-making. Additionally, we will discuss the importance of open and honest communication with patients and their families, the involvement of ethics committees, and the legal aspects of end-of-life care. Understanding the ethical nuances surrounding end-stage heart failure care is crucial for providing compassionate and patient-centered care. In the video on end-stage heart failure, we will cover key aspects of end-of-life decision-making. This includes patient preferences, family dynamics, medical futility, advanced care planning, prognosis, legal and ethical considerations, and frameworks for navigating these challenges. In conclusion, end-stage heart failure brings numerous challenges in diagnosis and treatment. We have explored the complexities surrounding its pathogenesis, prognosis, therapy, and ethical considerations to equip medical students with the knowledge needed for compassionate care. Advancements in cardiology offer hope for improved outcomes and quality of life in these patients through ongoing research and education.